It's estimated about 6 million Canadians don't have access to primary care. In Ontario, the number is at least 1.6 million and growing. The scale of the problem has the Conservative government in that province looking across the aisle. They've tapped former Liberal Health Minister federally, Dr. Jane Philpott, to lead efforts to close the gap, and she's with us now. Hi, Dr. Philpott. Good to see you as always. Thanks for making the time.
My pleasure.
I listened with some interest to what the opposition today was saying about your appointment and the process that will happen or will unfold now. And the NDP and even the Liberals, to a certain extent, were casting doubt that they believe the government will implement what you actually recommend. What is your level of faith at this juncture that they will?
Well, I can understand that some people might be skeptical because we have a history in healthcare for decades of people making great recommendations and nothing happening. What I can say to you is that this is not a job about writing a report. This is a role about actually making the changes, implementing the investments, and making sure that every person in Ontario has access to a family doctor or a primary care nurse practitioner working in a publicly funded team. It's a huge opportunity, and I'm really excited about it.
Do you think, or have you been assured at least, that they will follow through on what you ultimately determine is the best course of action?
Well, I think you know, Vassy, that I wrote a book that came out this spring that basically laid out the vision. I believe that we can be a country and we should be a province where every single person has access to primary care, and that means having health homes in every community. And I laid it all out with a grand plan of what I hoped that governments across the country would do. So the government is very clear on what I believe to be the recipe for what the people of Ontario need. I have not been shy about talking about the kinds of investments that are necessary. It's going to require significant investments in primary care. And I believe they are serious about wanting to make those changes. The people of Ontario are loud and clear about their desires for what they expect and deserve in terms of access to care. So I'm going to confidently move forward and really look forward to seeing how fast we can make improvements on the system.
And you're right, you have written extensively about what you think the prescription is to better access for primary care, not just in Ontario, but across the country. Was there any hesitation on your part, though? I mean, this is a political audience. We're very familiar with you as a Liberal cabinet minister. Was there any hesitation on your part because this is a Conservative government?
You know, anytime you take on a role that has to do with politics or government, there's always a certain amount of risk that's involved. Things change, as you know, as well as anyone. But I've been given the opportunity to lead this team, to make these implementations, to actually build a system that's never been properly built in Ontario or anywhere else across the country, where there will literally be a health home in every neighborhood. And so sometimes you have to jump in with both feet and give it your all. It's going to take a team, a monumental effort on the part of a whole bunch of people across the province to get it done. I'm excited that people are feeling hopeful about this, and it will take time to show that we can actually deliver on what I've been asked to do.
How doable at this point in time, based on everything you know about the system, how doable is it that, in 5 years, everyone now in Ontario who doesn't have access to primary care should have primary care? Because I take your point that people involved in the decision-making may feel some hope, but I think there's a lot of Ontarians and Canadians writ large who have lost hope about this situation. And I'm wondering, I know I can see from your expression that you've been, they convey that sentiment to you as well. Do you think it's possible to do what you are being asked to do?
If I didn't believe it was possible, I wouldn't have said yes to this job. So, and I don't do that just on the basis of fantasy and hope, but I do it on the basis of the fact that there are many countries around the world that have designed systems of universal access to primary care, where your attachment to a primary care team in your neighborhood is as natural as the fact that your children are automatically attached to a public school in their neighborhood based on their geography. So if so many other countries have figured this out, we should surely be able to do so in Canada. We've got lots of smart, well-intentioned people, and we need to follow that roadmap. And I'm thankful to be given the reins to be able to do this. And so this is an outrageous problem, but it's a solvable problem. And I hope that very soon people will start to see some real results. And people are waiting, so we've got to get to work.
You oversaw the system across the country. You saw how each province was different, how there were similarities. You saw where the improvements were necessary, where they weren't. You also controlled, to a certain extent, purse strings and money between the federal government and the provincial governments on where healthcare is concerned is a big deal. What is something specific that you learned from that position that you will bring to this one, do you think?
Well, I learned many things from that position. I learned how the federal government and the provinces work together or not work together, sometimes as the case may be. Healthcare really matters to every single person in this country, and they don't want to see their government squabbling with each other. So one thing I've certainly learned to do is let's not argue. Let's actually get to work and get the job done. I would also say that I have increasingly become convinced that one of our biggest fundamental flaws in Canada is that we have not designed our health systems so that they are rooted in primary care. And that means that we don't necessarily need to spend more money, but we need to spend it better. We need to spend it upstream in the right places. And there are always calls for more money in healthcare. I certainly heard those as a federal minister. In this case, it's not about necessarily spending more money. I think that once we build a proper system of primary care, we'll actually spend less per person, but we'll have a lot better access to care.
At the outset, you did mention earlier that it will require additional investment. Just to be clear, do you anticipate what you prescribe, and I'm taking fully into account that you haven't come to all those decisions, you're just starting the position, but do you anticipate it'll be more a real reallocation of money that's already on the table provincially for healthcare, or that it will require new money from the provincial government?
Well, as I said, we will have to put some initial investments into primary care. We actually, across the country, spend a lot less than other countries do on primary care. 5 or 6% of our healthcare spending goes to primary care, whereas countries that actually do better, get better health outcomes, spend less per capita, are spending more like 8 or 10% of their healthcare budget on primary care. So we tend to be spending our money downstream on the most expensive parts of the system, rather than detecting illnesses as soon as they are apparent, or doing the preventive care work that's necessary to manage chronic conditions so that people won't get sick. And all of that allows us then in the long run not to be spending more, but to be spending it in the right places.
I just have one more question for you, and it's political in nature. I hope you don't mind. You mentioned things change. We're doing this interview against the backdrop of a pretty precarious situation for the Prime Minister. I know that your time in the Liberal Party came to an end at a certain point. Do you have a feeling one way or the other, as someone who was a member of that party for as long as you were, about the future of the Prime Minister? Do you think he should stay or go?
Well, it's a really interesting time. I know you're following it closely, and I am too. I'm happy to know that caucus members are speaking up about their views, and I've always been a believer that people should speak up about what they believe the direction should be. I trust that the Prime Minister will reflect on what is the best for his party and for the country, and that he'll have the grace to respond in a way that has all of our best interests at heart.
So you don't have a position one way or the other at this point, you don't think?
I don't think it's my role at this point to advise the Prime Minister. He's getting lots of advice from a lot of people. But he's in a tough spot. It takes a lot of grace and humility to sometimes say, you know what, I'm ready to pass the baton. I suspect he's thinking hard about that, and it's going to be really interesting to see what the coming days bring.
Okay, Dr. Philpott, I'll leave it on that note. I appreciate your indulgence. Thanks very much.
Thank you.